Module 7 assignment on musculoskeletal injuries. The first one I'd like to talk about today is going to be dislocation and subluxation. Dislocation is the complete displacement or separation of the articular surfaces of the joint, and subluxation is a partial or incomplete displacement of the joint surface. Symptoms of subluxation are similar to those of dislocation but are less severe. Multiple structures can contribute to the stability of a joint injury, as well as the excessive ligaments as a major factor in locations or subluxations. Weak or atrophied muscles can cause chronic joint instability, and fibrocartilage structures such as the labrum around the hip, shoulder sockets, and the meniscus of the knee play an important role in stability. Even small tears in these structures can result in recurrent chronic dislocations and subluxations. Dislocations typically result from forces of the joint that disrupt surrounding soft tissue support structures. The joints most often dislocated in the upper extremity include the thumb, elbow, and shoulder. Posterior shoulder dislocations are rare. They typically only happen after an electrocution or a seizure. In the lower extremity of the hip is vulnerable to the dislocation of severe trauma, often associated with vehicle crashes or due to old age. Major complications of a dislocated joint are open injuries, inarticular fractures, avascular necrosis. It's when the nerve damage actually dies within the joint, and then the joint actually becomes necrotic. It's very, very damaging. X-rays will determine the extent of displacement, and the joint may be aspirated to assess for hematorosis or fat cells. Fat cells in the aspirate indicated a probable inarticulate fracture. It requires prompt attention, orthopedic emergency, and often surgery. The longer the joint is located, the greater the risk for avascular necrosis. The first goal of management of dislocation is to realign the dislocated joint to its original anatomic position. Sometimes open reduction may be needed. After reduction, the extremity is immobilized and a brace or splint is placed so the person can heal. And there's these cushions that you'll put on each side of your hip that you need to wear while you're in bed so your joints stay in place as well. A patient who has a dislocated joint may be at greater risk for repeated dislocations because of damage to the laxity or previously mentioned structures. Activity restrictions may be imposed on the affected joint to decrease the risk for repeated dislocations. And the next injury that I would like to talk about is carpal tunnel syndrome. Carpal tunnel syndrome is caused by a compression of the median nerve, which enters the hand at the wrist through the narrow carpal tunnel. The carpal tunnel is formed by ligaments and bones. It is the most common compression neuropathy in the upper extremity. It is associated with hobbies or work that require continuous wrist movement. Musicians, carpenters, computer operators. Obviously, these are just risk factors, and there is only a few statistical studies that can actually be for certain that these actually do lead to it. It can also be caused from trauma, edema from inflammation, cancer, rheumatoid arthritis, and soft tissue masses such as ganglion. Sometimes hormones are involved because the carpal tunnel nerve narrows with the carpal tunnel. Women are more likely to develop carpal tunnel syndrome because of the smaller carpal tunnel nerve. Numbness and tingling may awaken the patient at night. Shaking the hands often relieves these symptoms. Clumsiness is performed. Fine hand movements is common. To prevent carpal tunnel syndrome, you want to teach employees and employers the risk factors. Adaptive devices such as wrist splints may be worn on the wrists to relieve pressure on the median nerve. A special keyboard and pads and computer mouse for ergonomics and repetitive pressure for the median nerve is better. Definitely the ergonomic changes in the workstation, modifications, changing their body position, and frequent breaks from work activities. Early symptoms of CTS can be relieved by stopping the aggravated movement and by resting the hand or immobilizing. Splints can be worn at night in a neutral position to reduce pain and numbness. Physical therapy with hand and wrist exercises may lessen symptom severity. You can also take a corticosteroid injection at times if the patient needs. A change in occupation may even be needed at some point to relieve symptoms. Although symptoms may be relieved right after surgery, full recovery may take months. After surgery, assess the hand's neurovascular status, and then teach the patient about what to perform at home. Some of these symptoms that happen are, they could say, are being a musician and using your hands a lot from working on working on a line, like a factory line, something of that nature, but they haven't really, the statistics are not out fully yet. It could be caused, the etiology could be from those, but they're just now only considered risk factors. All right, those are my two musculoskeletal injuries that I'd like to talk about, which is carpal tunnel syndrome, dislocation, subluxation, as well as carpal tunnel. Thank you very much. My name is Gregory Glaser, and you have a wonderful afternoon. Thank you.